As you guys know, a packed schedule doesn't automatically lead to a healthy bottom line. If your daily operations are inefficient, right, you can have high no-show rates, providers with empty slots, or even just this chaos in the front desk, and that can leave a massive amount of money on the table. In our last episode, we focused on the core profitability metrics that measure the financial health of your practice. Today, we're going to be moving from what that profitability could be to how to get that done. All right, part one of our series, we explored the three core metrics that drive your practice's profitability. So if you haven't listened to it, head on over there, go check it out. Today, we're going to be talking about part two. So we're going to be moving from that higher level metrics to a more detailed level metrics to help you identify the levers to move to increase profitability. So as you guys know, we've worked with over 50 different groups in either RCM or consulting services. And we had one group that we were working with in Texas. They felt like they were constantly running behind. Providers were stressed, patients were complaining about wait times, but their revenue had been flat and they were not profitable. They were busy, but they weren't efficient. So by focusing on a few key operational metrics, they were able to increase provider utilization rate from 70% to 90%. And they were able to see more patients with the exact same staffing levels. So their revenue increased and their expenses basically stayed the same. And again, these are the key things that you're going to want to think about within your practice so you can identify ways to increase that profit margin. So today we're going to explore three metrics that will help you achieve similar results. And before we dive in, we just want to remind you guys that we have a couple resources that are out there. We're creating a few more that will be helpful for you and your practices. We have one, which is the margin protection playbook. So again, this is really working around patient AR. So you can head on over to notrevmd.com/margin-playbook. Link in the show notes as well. All right, so before we explore these metrics, here are some powerful numbers to really incorporate into your monthly review. So metric number one is going to be your provider utilization rate. So this is actually taking your appointment schedule, right, and understanding the percentage of available appointment slots that are actually filled with patients for each one of your providers. So it's basically a measure of how well you're using your most valuable resource, right? Your physician's time. And why does that matter, right? So you can have a physician who's there 5 days a week, but if they have a low utilization rate, that is going to impact their ability to cover overhead, cover their salary, and obviously contribute to a profit margin. We all know, makes sense, empty exam room, lost revenue. So how do you track this in order to impact that? So obviously healthy target benchmark kind of industry standard is 85-90%. So if your rate is lower than that, then that's an opportunity to improve scheduling. And this can also help you monitor whether or not it's time to start marketing for a new position, especially if you have the exam room space in there. And can also identify patients or physicians who are maybe are at that 99 percentile, who maybe you can decompensate. Maybe you can move some of their patients to another physician or another provider. So important to look at this and track this. Again, these are that higher level metrics. I wouldn't suggest these be the first metrics you measure, although it could be very important, especially if you are struggling with profit. So you really want to optimize your schedule in order to track this. A lot of the PM softwares and EMR softwares have an ability to run this as a report. So you'll just want to check with your software vendor to see if you can look at this. And again, I know we chatted about profitability and how many patients you need to see. So, in prior episodes, we talked about really understanding, what are you getting paid per visit, right? So that's that revenue per visit. And therefore, how many patients do you need to see a month, a week, a day in order to cover overhead and then cover salaries? And so when you look at your patient volume and your appointment volume, you want to make sure that you have enough open spots, right, to hit that minimum threshold to cover overhead, salary, and then obviously generate a profit. So it's important to make sure that you've set the open appointments correct. So if you need to see 150 patients per week, but you only have appointment slots of 100, even if you've got those 100% booked, you're going to be in trouble, right? So do want to just put that caveat out there that you want to make sure that, again, you've had the opportunity to sit down with a finance expert and really understand that information. So then you can say, okay, I need 150 spots or 200 spots per week, month, whatever, depending on your expenses. I need to see that many patients. Then you set your provider schedules to say, okay, you're going to see X number of patients per day per week, and then you can start tracking percent full, right? So just want to make sure to think about that. So if you've optimized for that, then you can start tracking percent full or percent appointments filled per physician, per mid-level, however you have your staffing. So then you're tracking, okay, we're 80% full, we're 75% full for this individual, we're 95% full for this individual. One, can you adjust schedules so that it's a little bit more even? And then two, if you have individuals who are much lower, what are the revenue generating activities that you can do in order to get patients filled into those spots? So obviously the levers to pull here are optimizing your schedule template, right? Are you allocating the right amount of time for different types of visits, right? Whether that's in an OB practice, new OB visits versus routine GYN versus blocking for surgery. The other piece you're gonna look at with this is, could you improve patient flow? So that's where it's really important for you to analyze that whole patient cycle. Are there bottlenecks? Is it, the front office? Is it getting checked in? Is it getting checked out? Is it getting to the room? Is it waiting for, an ultrasound? And so really doing a time study to really follow the life cycle of those patients within your office can make a huge improvement, especially if you're having profitability issues, if you are struggling to manage having a full day in terms of appointment availability and staying on time. The other lever is that if you have gaps in your schedule, right? So if you have open slots or you have physicians who say only have 60, 65, 70% of their schedule full, then that's when it's about setting up a process to get patients into the office. So that could be calling patients who are overdue for wellness exams or follow-ups for illnesses that maybe they could have come in, but they forgot to schedule an appointment. So again, it's creating a process so that weekly you're understanding who could have come in for a follow-up. Let's get those appointment slots full. Obviously, if you are jam-packed and you've got 95% fill rates, then the question is going to be different, right? Then it's about, do we have room to add another physician or provider? What do our wait lists look like? Could we add somebody else? So those are some things to think through. Metric number 2 is going to be your no-show rate. So obviously we all know what this is. It is the percentage of scheduled appointments where the patient simply just doesn't show. So for a practice where appointments can be long and hard to backfill, this is a very critical metric. Again, we're kind of stepping through in this part 3 or this 3-part series, really metrics that you can start to track. So if you are new to metrics, if this isn't new, start with that part 1 series where we talked about kind of revenue higher level. And these are kind of those in the detailed metrics that can help you start to pinpoint things. But I do believe that tracking metrics helps you understand where your practice is. So please, please don't go blind and make sure that you're understanding these things. Otherwise, it's hoping and praying at the end of the month that you are covering your expenses, which nobody wants to feel that way. So again, no-shows. What is that percentage? Can you pull a report at the end of the month and understand, okay, was it 10 appointments, a day, 10 appointments a week, 10 appointments a month that were no-shows, and then be able to look at that as a percentage of scheduled appointments. So obviously, we all know why this matters, right? No-shows mean you're not getting paid. Obviously, you can set up many different mechanisms by which to decrease this, right? Obviously, putting credit cards on file, charging $50 no-show fees, setting up scheduled reminders. I know for my dermatologist, I think I get so many reminders, I'm almost annoyed, but they are sending reminders a week out, 3 days ahead. the day before, I'm getting text messages, I'm getting emails, all the things. And as annoying as that is, so obviously I know why they're doing that, right? It's important for them to be able to make sure that I show up so that they can make sure that that slot is fully utilized. So obviously a high no-show rate, so really industry standards say anything above 5% is an opportunity for improvement, which just means that your appointments are filled with basically patients who aren't going to generate revenue. Even if you do charge that $50, it still doesn't typically cover the full visit. All right, so levers to pull, right? Obviously, we talked about this, automated appointment reminders, text, email reminders, confirming appointments. Use a software to make this work. Please don't have your office staff be calling patients for this. There are better ways to do it. Use a software. In today's day of AI and all the things, just make sure that you have some sort of automated system. Obviously, no-show fee. Now, you do have to consistently enforce this, especially for longer appointments like new OB visits. So you just really want to make sure that you're clear up front, there's a no-show rate, that you even put that in your reminders, and that you have an easy way to charge that if they do not show. Another option is to offer a telehealth option. So if a patient can't make it in person for a consult or follow-up, maybe there's a way to do a quick telehealth visit as an alternative, especially while this telehealth extension continues. So it's a better way to capture some revenue than none at all. All right, metric number 3, patients per physician per day or per provider per day. So what is this? This is a simple, kind of more nuanced metric than what we've been talking about, but it allows us to understand your team's productivity. So it is the average number of patients each of your physicians sees in a single day. Obviously, this is going to vary depending on your practice mix. If you are in an OB or GYN practice, if you've got a lot of OB patients, that's going to change versus you're just seeing GYN versus you're seeing peds versus internal medicine. But you are going to want, again, to set that target of how many patients per day. And again, that's kind of goes back to our previous discussion around how many patients does everybody need to see on a per day basis just to cover overhead, and then how many additional to cover their salary, how many additional to start having a profit margin. And so then you can start tracking that on a per day basis and even be able to track trends. So you can look at, what is your average patients per day on a Monday, on a Tuesday, on a Wednesday? Do you have more need for patients, say, on a Thursday or a Friday than you currently have? Should you open additional patient slots on those busier days where you're constantly full? So then maybe, again, you can inch up the number of patients that your practice is seeing per week. Obviously, if that number is significantly lower, right, the number of patients you're actually seeing is lower than what it is to cover overhead, then that's, again, an opportunity to understand what are those revenue generating activities, how do we get patients in the door, or are the physicians spending too much time on administrative tasks and they're unable to see more patients because of that? Is the EMR slowing them down? Are there patients, waiting for MAs to room the patients? What does that workflow look like so that you are constantly hitting those benchmarks? Again, if you don't have a benchmark set and then you're not tracking those numbers, it's going to be challenging for you to understand, are you hitting the number of patients per day, per week that you need to in order to sustain profitability. And again, I know that for a lot of you guys, you're thinking, I'm already seeing patients 5 days a week. I don't have time to do this. This is a great activity for even a remote, someone in kind of in the finance world, an accountant who knows healthcare, who could help you set up these benchmarks on a per week, per month basis. And then you could, spend 30 minutes a week with them while you're trying to tweak these numbers and just understand, okay, where are we at? What are we monitoring? They can help pull these numbers for you and then be able to set up a tracking system so that they're putting those in there so that you're spending, 30 minutes going in there, checking these numbers, and quickly, working with your front office, working with your physician team, working with your marketing team, whatever it is in order to necessarily move that needle. So obviously, when you're tracking all of these things, this is what allows you to start understanding what you need to do in order to improve the workflow in your office. Obviously, if administrative tasks are bogging people down, then it's what software, who can you help, provide as a resource, right? Is it, how you're using your MAs? Do you need scribes? What about technology to automate, patient reminders, for example? We have a practice right now that's reviewing some more AI automated tools for eligibility. We will let you guys know how that goes. That's just, a very time-consuming task. And I know a lot of PM softwares have something in there. It's just not perfect, especially if you're dealing with COB issues or you are in urgent care where you have patients coming in and checking in at the point of service, right? You don't have several days in advance to check insurance eligibility. And as you guys know, we do have an eligibility toolkit. It is long and detailed, but it is helpful if you are trying to train your front desk and set up a policy and procedure. So you can check the link below if you guys want to check out that resource. Another thing is optimizing your EMR. So do you have subspecialty specific templates that are efficient? And can you use certain macros or voice to text to speed up documentation? And if you don't, or if you feel like these are clunky, I highly recommend sitting down with your EMR team and being able to help create those and make those more efficient. I know not all EMRs are great at that. Some are better than others. Highly recommend, especially if you're growing and you're trying to make sure that you're hitting those profitability metrics, that you really, really identify the right EMR practice management software for your team. Last is communication, right? So you really want to be able to have a system to let your team know when rooms are clean, when patients are ready, when a physician needs support, or a mid-level, for example, needs support from a physician is probably a better way to put that. So, whether that's color-coded flags or, folders that are at different stations so that everybody knows what's going on, but you just have to have a system. And, this is where, if you're not a systems person, if you're not great at understanding, or understanding is probably not the right word, if that's just not what you love to live in, right? If you're like, oh gosh, if Heather makes me build a spreadsheet or create a workflow, then I highly recommend identifying even a consultant part-time who can come into the office and walk through, okay, here's my patient workflow, here's where my bottlenecks are, and even just somebody to sit and observe that process, do a time study, and then identify the bottlenecks, and then be able to write that workflow down and identify and train to that so that everybody has clear, consistent mechanisms to bring patients back, to check patients in, to check patients out. It's really, really important. It helps your workflow. So if you do have a really busy day, but you're still not able to hit and see as many patients as you need to in order to hit those profitability metrics, this may be one mechanism to look at. All right, so to recap, 3 metrics that can drive practices efficiency are: number 1, provider utilization rate; number 2, no-show rate; number 3, patients per provider per day. Again, setting those benchmarks and then tracking and trending those numbers is really, really important. These 3 really do go together. So obviously tracking these numbers monthly, you can move from a state of this chaos to hopefully efficiency, but also knowledge that at the end of the month, you're financially going to be good, right? So I think that's one of the most important things that I hear over and over again. By tracking these numbers monthly, you move from this constant state of chaos to hopefully controlled efficiency so that you have better end of month process, right? You're not guessing whether or not you're going to cover expenses at the end of the month. You know that you've hit your target, and you know you're slowly improving processes to increase profitability is one of the best feelings, right? So highly, highly recommend, building upon these metrics. Again, this is part 2 of the series. We'll do one more of these. So for some action steps, first one is calculate your numbers, right? For the next 30 days, track these 3 metrics. What is that current utilization rate? What is your no-show rate? What is your average patients per provider per day? Identify those big opportunities, which of these 3 numbers is off target, and that's a good starting point. And then just pull one lever at a time and build upon it month over month, right? If it's no-show rate, let's work on that. If it's you have no idea how many patients physicians need to see in order to hit and cover expenses, then start there. If you know that number, then it's, okay, what is the percentage that my physicians are actually seeing? Or are we getting 70, 80% of that target met every day? And if not, then what revenue generating activities? Or if you're not able to hit that percentage, right, you're at 70%, but you feel like jam-packed, then it's about workflows. What is the workflow going on in the office that then you can help improve? So again, you can see more patients and it not feel chaotic. All right, I know lots to work on, but hopefully this helps. And as always, if you are enjoying our podcast, I'd love for you to share it, subscribe wherever you're listening to this. We do have a YouTube channel where we do the videos for this, so you can go check that out as well. Subscribe there and share with a friend. All right, have a great day.